Hi there, good morning. This is Leela with Sisters of Sacred Spaces, and I wanted to talk a little bit today about why birth work is about community work, and how hospital work is more so about medical intervention. So, if you're new to anything around birth work or home birth, I want to give 5 reasons why birth work transcends medical care. And I want to highlight some things. So, first off, personalized support. When you're dealing with home birth, you're getting support that is personalized to you. There are things that you may need that other people might not need, and vice versa. Whereas at the hospital, they're going to treat you kind of like everyone else. They have certain procedures and things that they want done. And even if you don't need it, more than likely they're going to suggest it or demand it of you. The second thing is continuity of care. So when you're working with a midwife and doula, there is such a strong connection and rapport that is built in that relationship that consistently is there for you throughout your whole entire pregnancy. This is huge because this allows you to be able to tell them exactly what you're needing and also them to be able to see what you might need that you don't even know that you need. And this is because there is a relationship built. There's time spent. Whereas if you're at the hospital, more than likely you're having a 15-minute visit. They're checking your blood pressure. They're measuring to see if you're measuring correctly. But there's a lot of things that are going on underneath that are not being addressed. 3, safe and comfortable environment. What's more comfortable than being at home, or being in a office that feels like home, that feels like you're just stepping into a friend's house and able to sit and enjoy and be relaxed versus going to a hospital where there's people sick, they're hurting, they need some type of medical procedure done, and you're in complete health, but that is where you're going for your checkups to see if everything is okay. There's always a sense of like, what's going to happen this visit? I hope everything's fine. Versus with home care, I have found it personally to be more so. I'm so excited. I can't wait to see my midwives. I just want to be able to talk and catch up and also progress in this pregnancy and see where I'm at. 4, empowerment and autonomy. I think with birth is so very important for us to have autonomy over ourselves and how we feel and what's going on with our bodies. Unfortunately, with hospitals, there's lots of protocols and guidelines, and those are crucial for the safety of the employed nurses and doctors and the physicians that work there. It's not necessarily for the safety of the person coming for medical help. And number 5 is community-based care and education. I mean, when you're in a home birth, there's so many things you can learn. There's opportunities for workshops, classes, and meeting people versus in the hospitals, you're not going to really meet anyone. They might give you a list of classes that you can take at the hospital. And, that's fine, but there is definitely more of a focus on these things and community support and creating a supportive network when you're working with a midwife. So next time I'm going to break each one of these down and kind of go a little bit deeper into it. So stay tuned.